Namaste, Namaskar, and welcome to Apollo 24/7's Health Hour. Health Hour is a show where we bring you experts from Apollo hospitals every week to this Sunday live show. 1 hour, we have the expert on the show where you can ask all your questions and queries. We bring the solutions for you. Today, we're going to talk about bleeding gums and how to take care of them. And our expert, Dr. Shweta Mathur, who's a dentist from Apollo Hospitals Noida, will be joining us very shortly. Before we begin the show, I urge you to download Apollo 24/7 app, which brings the entire facility of Apollo 24/7, Apollo Hospitals, pharmacy, lab tests, everything to your fingertips. And also, there are a lot of benefits. If you choose to download Apollo 24/7, I'm going to give away discount vouchers and gift coupons, which you can be using on Apollo 24/7 and get wonderful discounts as well. So, let me also remind you that this show has a health quiz towards the end where you can answer 3 questions on YouTube chat and win prizes from Apollo 24/7 as well. तो चलिए आज के टॉपिक के बारे में बात करते हैं. ब्लीडिंग गम्स, मसूड़ों में जो ब्लीडिंग होती है कभी कभी, एंड देन वहाँ से सीरियस प्रॉब्लम्स भी हो सकते हैं. लेट्स टॉक अबाउट देम. लेट्स मीट एंड इनवाइट आवर एक्सपर्ट टुडे, डॉक्टर श्वेता माथुर. Dr. Shweta is from Apollo Hospitals Noida, and she's a professional member of IDA, Indian Dental Association, WCLI, that's World Clinical Laser Institute, and she's been well awarded, and she's a wonderful writer, author. She's journaled some national and international anthologies as well. She's been awarded with the ALS Sphere Women's Alliance Conclave 2022. She has a fellowship in laser dentistry from University College of London, United Kingdom from 2022. Geetesh Biwa Award in 2022 for writing on women's issues, and Wordsmith Award 2021 for short stories on women. She can be consulted for aesthetic smile designing or makeover, tooth caries and root canal treatment, surgical procedures, laser whitening, dental pain, or any oral infection. So let me invite Dr. Shweta Mathur onto this show. Good morning, ma'am, and welcome to the show.
Good morning, Lakshmi, and namaskar to all the ones who are seeing us today live on a Sunday morning. Thanks for being here.
Such a beautiful smile. I must say our audience are lucky to have a person who can make them smile and make their smile look good too. So it's wonderful having you on the session.
Thank you. Thank you, Lakshmi.
So, Dr. Shweta, oral hygiene, we all think that it's only about teeth. But bleeding gums or gum ke issues jo bhi hai, I think those are the larger population faces these on day-to-day basis. Do you think that gums get a bit of lesser attention than tooth?
I think you are absolutely bang on the topic. In India, we have seen that gingival health is most ignored topic or theme to be talked about. We always concentrate on the teeth. We market, we see ads about brushing, about white color, but we ignore the most important part, which actually support these teeth. So even if your teeth have no decay or no cavities, as the normal people say, if the supporting tissue or the gums are not in perfect health, the best of your teeth can fall off. So it is
Right.
more important to take care of the support system, which will take care of your teeth forever.
तो अगर घर बनाना है तो बुनियाद सही रहनी चाहिए. And if your teeth need to be strong, then the foundation is your gums. Right.
Rightly, rightly.
I'm from Hyderabad and I speak Telugu. So most of the Telugu population have this a poem or a padyam, we call it in Telugu, which says that jute me cheppulona rai, chevilona joriga, and kantilona nalusu, intilona poru. I'll quickly translate that for you. ये जो प्रॉब्लम्स मैं ऑर्डर में बता रही हूँ वो बड़े प्रॉब्लम्स है जो जूते में स्टोन, आंखों में कुछ गिरा और कान में कीड़ा और घर में जो भी प्रॉब्लम, ये बड़े प्रॉब्लम्स है बोलते हैं. नाउ आई ऑल्सो से ऐड टू दिस पंटिलोना नोपी, दैट इज ये ब्लीडिंग गम्स भी बड़े प्रॉब्लम है. लेट मी ऐड दैट टू द थिंग. सो नाउ let me also tell people that when we think that there is bleeding in gum, I know people who say that this is normal. हाँ, रोज मैं ब्रश करता हूँ ना इसलिए वो थोड़े ब्लीड होते हैं. Is bleeding in gums a normal thing, day-to-day thing?
No. Never accept bleeding from gums as a normal. day to day activity. This bleeding can occur occasionally without absence of any diseased state, even if there is a trauma. That trauma
हाँ.
can also occur with your brush itself, but it
Oh,
cannot be normal. You understand? It may not be something big, lethal to be thought about, or to be consulted a doctor, but at times, brushing in the wrong, aggressive manner leads to injuring of the gums, mechanical
okay.
injury to the gums, which can also cause bleeding. So, bleeding
Nice.
per se is never normal. It can be of a simpler or a higher degree of worrisome, being worried about.
Right. So here's Utkarsh Yadav who's asked, a 32-year-old male, my gums are bleeding while I'm brushing teeth. So what extent is okay, what is not okay?
Very smart question, Utkarsh. I'm sure the young chap knows how to question the question well. So, Utkarsh, this is for you. Brushing and bleeding go simultaneously. Now, why? Because brushing, I have just spoken about, is a mechanical trauma to the gums, right? When we brush or when we rigorously apply friction to an diseased area, it will bleed even more so when we apply friction to a normal surface. When we have infection in our gums, the blood capillaries of the gums tend to get swollen up, right? Because
Okay.
they are harboring bacterial colonies also. Now, if we rub or apply friction against these diseased capillaries of the gums, they tend to break open and burst, and blood comes out. This is a very normal thing which happens the first thing in the morning when a diseased individual who has a gingival disorder starts brushing his teeth. The question where to get worried, where not to get worried, I have always believed in getting worried on the step one.
Oh,
Understand? No one can decide that your bleeding is normal, because the bleeding can not only indicate a minor thing, it can also indicate a persistently occurring latent major problem in the body.
okay.
So
Okay.
never ignore a gingival bleed. That we were just talking about a mechanical trauma. You can do some trauma, take a pin and injure your gums, a safety pin for that matter. A lot of girls do that, safety pin, tucking your things here and there.
Correct.
Uh, that trauma can also develop into an infection. So be alert at step one. It's never early to report a gingival bleed. Utkarsh, I hope that
Wonderful.
helps you.
Yes, it helps everybody. Thanks, Utkarsh, for asking this question. So do not ignore. And now it is Yogesh, who is 66-year-old male. How to prevent and cure gum bleeding. Now you've identified the step one. कि पहले दिन ही आप उसको पकड़ो. Then what is it? What can I do to stop this? Can I, do something at home, or do I have to visit a dentist?
Yogesh ji, you have asked me a question which actually sums up maybe 3 or 4 chapters, and if I was in college, a couple of books. But I will try to be as precise as possible. The moment you detect that you are having gingival bleed, uh, you should not aim to cure it at home. I will tell you why.
Okay.
Because the reason for the bleed is to be known. Whether the reason for bleed, is it curable at home? I hope you understand what I'm trying to say. The gingival bleed occurs due to various reasons. It can occur due to trauma. It can occur due to infection. It can also occur due to certain medications that we have. It can also occur due to certain systemic disorders that we face. So, first, it's important to know the why.
Okay.
If certain extreme conditions are ruled out from the body, and we make a permanent diagnosis, we make a definitive diagnosis that it is because of infective origin, or it was a transient phase, then we can deal it in that manner. But if not, then it requires more extensive treatment. So,
Right.
first step is to know the why and then to treat the why. The gingival bleeding, it will it stop in itself.
So it's wonderful to see that you got to be aware of what your oral health is, and it's got to be a daily procedure, not just once, but multiple times that you eat, you drink, you brush, you put something in your mouth. It should be more of a mindfulness all the time. Yeah. So while
Yes.
I ask that, most of us are not mindful. Here's a question which I wanted to ask. Dream bird, इनका नाम, age, gender कुछ मुझे पता नहीं चल रहा है question से. Bad breath. What helps to deal with bad breath? So I understand that first sign of oral health or oral hygiene is poor. That indication है bad breath. So what do you? There's no question there, but I think we should talk about bad breath.
Bad breath, or halitosis as we call it in dentistry, is a very debilitating disorder, debilitating for your social presence. 90% of
Correct.
the time, 90% of the time, the patient, him or herself, is not the sufferer, because one
Right.
does not really realize the problem is faced by the individual, the person who is talking to you, who's sitting close to you, or your partner. And why I call it debilitating? Because people try to then move away. And then it sets up a little negativity in your persona, which is the worst disease ever. So, halitosis has to be treated with aggressive attitude. Again, when a patient comes into my dental operatory and complains of halitosis, my first step is to first track the reason of halitosis. Now, again, I may sound a little diplomatic here, but again, I have to know what causes halitosis. Please remember, mouth is a gateway. It is a gateway of our body. It can release smell, a smell of putrid infection, which affects not only the mouth but my throat. It can also reflect or assimilate smells if I have a chronic chest infection. It can also reflect any stomach disturbances, gastric smells. Are you understanding? So it
Very,
is
very.
very important to eliminate, to reach the correct diagnosis. Not all patients I should be treating as my patient, because then I am misdiagnosing. So halitosis also needs to have a perfect diagnosis. However, if I have eliminated stomach, any chronic chest infection, any chronic existing throat infection, then what do I see for in my dental operatory? I see for deposits between the teeth. I
Ah.
see for boggy, inflamed, red, tender gums. This is where pus in form of bacterial infections is harbored, and it gives out putrid bad smell, which we call as halitosis. So
Okay.
halitosis patient, if centering in the oral area, can be treated very well by our treatment modalities, which are namely by oral prophylaxis or by root planing or by advanced certain procedures by the lasers, which are the most definitive way of getting rid of bacterial infection and halitosis. And my patient can be a happy patient with a lot of social company soon. So, halitosis is a completely treatable disease.
So wonderful, मैम. थैंक यू सो मच फॉर थ्रोइंग लाइट कि जो अंदर है वो बाहर स्मेल की वजह से पता चल सकता है. दैट इज वन फर्स्ट थिंग आप रूल आउट करो कि आपके अंदरूनी हेल्थ का सिग्नल बैड ब्रेथ है. सेकेंडली, gums itself can harbor disease, and that thereby your bad breath can. Here's a registered users question that I found now. Can gum disease cause bad breath, and how do I resolve it? So now, because you've already answered a first half, how do we resolve? You were talking about treatments, procedures that you could do in your clinic. What are they, and what are the newer treatments available?
Okay. So, the treatment modalities that we follow conventionally for boggy, inflamed, infected gums, for bad breath, can be classified into conservative, medicinal approach, and surgical. And
Achha.
the latest procedure that has come, the use of lasers. which I specialize in. So first we will go for the conservative because I am the kind of person who believes to be grounded. So the
Wonderful.
most common, the most commonly treated, this common existing problem. Now, why I'm saying commonly treated, because this is a commonly occurring problem and can be commonly treated by common treatments. Okay, so is by is called scaling or oral prophylaxis, which we do by means of a jet of water, a simple jet of water at a high speed, and remove all deposits in the interdental area. We clean the gums because now, if I can take a minute of yours in this question to make you understand better, the gums are not stuck to the teeth. Please remember that. Okay?
Oh,
The gums
they look
are
as if they
attached.
are.
Yeah, yeah. The gums are attached to the teeth approximately 1 to 2 millimeters below where they seem to be. Thereby,
Okay.
it forms a fine corridor. I hope you can visualize a corridor between the hard surface of the tooth and the soft surface of the inner side of the gums.
Wow.
Now, this sulcus, as we call it, and corridor for my patients who are not into the medicinal field, I want you to understand it in layman terms. Now, this corridor has one hard wall and one soft wall. So, what happens?
Okay.
Whatever we eat, fine pastry form of that food pushes the soft wall and forms a tuck-in area, and it keeps on going there. Now, this tuck-in area is not in our visible zone, and therefore we do not clean this area. What is not in our sight is not in our mind. Okay, as the saying goes. So this sulcus keeps on harboring food particles, and with time it harbors bacterial infection. This is where the gingivitis means inflammation of the gums starts to happen. When we do scaling, we remove these adherents from this sulcus area. We clean this corridor. We clean the interdental, like I'm talking about interdental between the teeth area. And something to remember is that there is a gap between your teeth given by him who designed your body. The teeth are not supposed to be joined to each other, they are just standing along. So remember, there has to be a gap. So if you feel that my teeth do not have a gap, there should be a red alert signal, go to your dentist. Okay?
Right.
So you clean these areas. When the moment you clean these areas by normal scaling, your gums bounce back. They are now able to access better nutrition from the blood capillaries. There are no adherents. 90% of gingivitis or slight bleeding cases revert back from here. We do not
Wonderful.
proceed further. We do not proceed further. But this treatment applies only to the people who responded on the first warning sign.
Yes, ma'am. One question. So, what is warning sign से लेकर ये growing back gums into good health and shape? What could be the proper timeline? When should I, if I've reacted early on, and when do you think that I can achieve good gum health again?
Human body, Lakshmi, is highly resilient. I have noticed that. And it really bounces back. So the moment you notice that I have been noticing gingival bleeding while brushing for a week now, I need to go to the dentist. So we do a simple procedure, we send you back healthy, and then you follow the oral hygiene protocol, which I shall be telling you in later half of the session. Now, if it is ignored and your gums start looking boggy basically means a swelling here and there. The tone or the color or the hue of the gums are different in different zones. Now we have entered stage two.
Okay.
This is where the infection which was in the corridor or in the sulcus has now dipped down. It has broken the attachment between the gum and the tooth and it has dipped down. And now it is going to affect the root portion of the tooth. Now, when the patient approaches me at this stage, we do a procedure which is called the root planing, basically with hand instruments. And of course, now lasers have come into being where we clean the root surfaces and look at the beauty of the human body, that it again heals. But this is when we deal the patient in stage two.
Right.
I hope I'm
So
able to answer your query.
perfect. I think Priya Gupta and Manish Sharma, I hope you're listening because they have asked these questions. Once the gums start bleeding, how do you take care? I think this is the perfect answer. Please go on listening to Dr. Shweta. Please continue, ma'am. So this is very interesting. Stage one में पकड़ते हो तो जल्दी हो जाता है. Stage two में भी आपके options है ताकि आप planning कर सकते हो.
Yes.
And how long will it help me back to recover once you've done the planning? Is
It
there a
does
chance
take
in option?
every body healing is always dependent on a particular time frame of 3 weeks, be it a cesarean section, be it a gum surgery. We have to respect the body. Okay, so you
All
give
right.
yourself that time. When we do root planing, we also give you certain medications, okay, to ensure complete eradication of infection. Now, this medicinal support can occur in every stage depending upon the dentist analysis and diagnosis. Uh, when we notice that along with the bleeding, my teeth have started showing me fine mobility.
हाँ
The teeth may
हिल
become
रहे
a
दांत
little, हाँ, कुछ लोगों को सिर्फ टंग से पता चलता है, दे आर नॉट मूविंग पर से, बट यू फील आई थिंक my tooth is showing me a little deflection. Now this is
लूज
the
हो गया
not,
है
yeah, now this is not a warning sign. There should be a bell now ringing in
oh
your.
that's a red flag there
Now you, yeah, now you rush. Now you rush. And now this is where I start telling I'll try my best, but I don't promise that I will stabilize the tooth. Okay? And this is where surgical interventions start happening, where we do flap surgeries or gum surgeries. We open, we clean, we may put a bone graft because mobility simply means that the supporting bone has loosened, has disintegrated. This is where bone graft materials are applied and flap surgeries are done so as to bring about stability. Again, at this stage, we can bring the patient back to normal, but that patient will always be on a review. The latest procedure that has come up is called the lasers, the use of laser. Laser basically involves radiations of a particular wavelength which are highly susceptible to bacterial presence in the mouth. Okay, so this is a highly conservative, painless, medication less procedure that kills the bacteria without any invasive surgery from the gums. So it gives my patient the best of both the worlds, a disease free mouth without any surgical intervention. So this has really made a big foray into the field because I treat medically compromised patients also without any worry with lasers, without any
wonderful
worrying of stopping their certain medications, without altering their medications, and not interfering in their usual treatment modalities. So do not
this is
worry, gingival health can be treated if you get alert at any time, but sooner the better.
all right so I would want to understand if I'm ignoring it's not just ignoring gum health it is going to lead to tooth decay or cavities here's a question Sudeep Mandal ji push rahe hai, how do I stop tooth decay and cavities so are these two interrelated
uh, Deepji, they are not per se the same topic. We are talking about soft tissue health, and tooth comes under hard tissue. But if you ask me, can I prevent having decayed teeth by taking care of my gums? Absolutely. Because the moment my patient takes care of his gums, he's taking care of the teeth as well. If he's brushing
perfect
regularly, if he's going to the dentist, you won't have any decay. But Of course, there are two different tissue bodies. Today we are dealing with
Correct.
soft tissues.
But the gateway to oral health is by taking care of your gum health and oral hygiene.
Absolutely. Absolutely.
So that's
Absolutely.
one
So
way.
by doing one, we are achieving both.
करेक्ट बट अगर आपके टू गम में भी प्रॉब्लम है और कैविटीज भी है डीके भी है तो टू डिफरेंट सेक्शंस आर दीज टू डिफरेंट सेक्शंस टू बी हैंडल्ड सेपरेटली if
Yes,
they
they are.
are there simultaneously.
They are. Yes, they can be handled simultaneously also, but they are two different problems. Tooth decay is more related with bacterial invasion in the tooth itself that causes decays, caries, a root canal. Uh, and gingival health is the most common problem that occurs in Indians. Believe me, Indians are
हाँ.
more prone to poor gingival health than decay.
Is there
So,
any genetic or some kind of predisposed reason,
uh,
or is it just
Lakshmi,
a practice?
whenever we have tried to understand this problem, and we've done various studies, we have always come down to the same conclusion about the fact that dental or the I should say oral, let me use the word oral. Oral means mouth. Oral health in our country has been an ignored topic.
Absolutely.
We have not been vigilant, and I don't blame. I'm not here to hoist a flag. I'm just here to tell that as I tell all my patients कि हमारी country अभी भी रोटी कपड़ा मकान के पीछे है, तो थोड़ा dental health पर से एक back seat लेती है. ठीक है. So
Right.
keeping that in mind and respecting the stage of our lives that we are in, and we are progressing very rapidly, we've all seen it in the last week, so we'll reach there. But dental health थोड़ा सा ignored है, and इस वजह से a combination of all myths associated with dentistry, that's another big topic. कि हम ट्रीटमेंट करवाएंगे तो हमारे दांतों को नुकसान हो जाएगा, that is another. A lot of myths are associated with dentistry, because of which gingival health sort of takes a back seat. दांत में जब दर्द होता है, फिर भी people go to a dentist. When we have severe toothache, we do rush to a dentist. But gum health, bleeding of the gums, we take it for granted because it is a slow chronic pain which a human being gets adapted to, and do not
Right.
report it as a first thing.
Okay, okay. So, okay, that's a larger debate that we're going to open. Key. I will come back to that. Our oral hygiene practices as a culture, as society, I'll come back to that. But now I have two questions. One a very simple, basic question, and one which is going to open up into a larger discussion. Which one would you want to take first?
Let's take the smaller bite.
राइट तो मिस्टर योगेंद्र वशिष्ठ पूछ रहे हैं कि कौन सा टूथपेस्ट इस्तेमाल करें कि मसूड़े मजबूत रहें.
Yogendra ji, your question is $1 million question. Something that I encounter every day in my dental operatory. All my patients ask, "Ma'am, toothpaste prescribe kar dijiye." Now,
Right.
as a principal, I never prescribe any toothpaste. Now, why?
अच्छा.
So why I'm going to say that is, if you do not require a medical or a medicinal toothpaste decided by your dentist, if you do not have enameloplasia, if you do not have a tooth defect, and I do not feel that you require a medicinal toothpaste, that situation, you can use any toothpaste whose flavor you like.
So
I'm
neither you
not saying.
prescribe nor you advertise.
Yes. Now, why I will tell you. What is the function of the toothpaste? These days, there's a lot of marketing about इसमें नमक है, काली मिर्च है. A lot of things go on. Believe me, when we use a toothpaste, the toothpaste has only one function, and that function is a lubricant. It is a
Ah,
lubricant to help to ease my brush to move on the gums and do not harm the gums. What is a brush? Brush has hard bristles. It can injure my gums and cause gingival bleeding. The toothpaste is a lubricant which helps it to slide slowly, steadily, easily, and not injure my tooth surfaces. Okay? The bristles at times are so hard that it injure the tooth enamel also. Now this is again another topic जो hard tissue वाले पूछ रहे थे. So lubricant है. A toothpaste is just a lubricant. Remember that. Why I say the flavor that you like? Because it is in the oral zone. I don't want you to do something you don't like, something that makes you feel fresh. Anything. Some people like mint, some people like any other flavor. Go for it. But if you think that a toothpaste is going to avoid any disease, no, that will not happen. Now, second question is, when a dentist prescribes you, then that dentist can prescribe you higher fluoride content toothpaste if required. Now, that if
If
required is to be
required.
decided by. That's exactly what I'm
Yes.
saying. I'm not going to name anything because I know people just go and buy things. Your dentist will decide if it is required. If you
Okay.
require something for sensitivity because your enamel tubules are defective, if your tooth is treated, if your tooth is worn or facets are made, that is a situation where a medicinal toothpaste will come into the picture, but that will be written only if required. Do not do not use even simple hypersensitivity toothpaste. A lot of toothpaste are there. I always say
Correct.
don't just go you and start using them on your own accord. Don't, because your body starts getting used to a medicinal thing. And when you actually require it, it does not help
It will
you.
not.
So,
Correct.
so please be
So
conservative. Be conservative, be grounded. Use the toothpaste for the function it serves. If more function is required from the toothpaste, your dentist will give you one.
ग्रेट, थैंक यू. लगा था मुझे सिंपल क्वेश्चन है, पर योगेंद्र कुमार वशिष्ठ जी ने एकदम सही क्वेश्चन पकड़ा है. इनका एक और क्वेश्चन है. 8 साल की बच्ची, उनके 2-3 जाड़ निकल गए हैं प्रॉब्लम के साथ, फिर वापस उग जाएंगे क्या? इनके क्वेश्चन है. सो वुड यू वांट टू प्लीज आंसर द सेम? आई नो इट्स नॉट इन द कैटेगरी दैट वी आर टॉकिंग, बट
इट्स ओके. वशिष्ठ जी, ये जो क्वेश्चन है ये थोड़ा सा डिबेटेबल है बिकॉज वी डू नॉट नो विच टूथ हैज कम आउट. जो बच्चों का डेंटिशन होता है वो 6 years से 11 years के बीच में चेंज होता है. रिस्पेक्टिव टीथ गो एट रिस्पेक्टिव एजेस. सो एज ऑफ नाउ अगर हम एक बच्चे की बात कर रहे हैं, द पेशेंट्स हिस्ट्री वी डोंट नो कि कौन सा टूथ निकला है और हम कौन से
सॉरी.
टूथ के आने का.
या सो इनके जड़ खराब हो गए थे, अभी निकलवा देना है. फिर निकलवाने के बाद दूसरी जड़ आ जाएंगे क्या? दिस इज द क्वेश्चन. सॉरी.
8 year old पेशेंट के तो सारे ही दांत दोबारा आएंगे. आप ये मत सोचिए. अगर लेट मी बी स्पेसिफिक, 6 years में उनके आगे वाले दूध के दांत गए होंगे आपकी डॉटर के, और वो आ गए होंगे. अगर वो जो दांत पक्के आ गए हैं वो इन्फेक्टेड होकर टूट गए हैं तो वो फिर दोबारा नहीं आएंगे. बट द मिल्क टीथ जो गए हैं वो दोबारा आएंगे. आपको समझना है, मैं यही आपको समझाना चाह रही थी कि कौन सा टूथ गया है ये मुझे नहीं मालूम. 6 years में हमारे बच्चों के आगे के जो फ्रंट टीथ होते हैं वो रिप्लेस हो चुके होते हैं. तो अगर उन दांतों में कुछ हो गया है तो उनका रिप्लेसमेंट नहीं आएगा. बट जो मिल्क टीथ हैं उनका रिप्लेसमेंट डेफिनेटली आएगा.
जो पहले नहीं गिरे हुए नहीं है अभी तक, जो गिरे नहीं है वो तो वापस आएंगे, पर अगर
हाँ,
गिर के फिर आ भी गए, दोज विल
आ
कम
चुके हैं
बैक.
तो वो दोबारा नहीं आएंगे. यू हैव टू बी विजिलेंट. यू हैव टू बी विजिलेंट.
Yes, ठीक है, that's for a later discussion. Now I'm going to open up the Pandora's box for you. Mr. Subbaraman, Krishnan Subbaraman is asking, does diabetes cause gum bleeding? So let's open diabetes.
Mr. Subbaramam, good morning. Happy Sunday to you. Diabetes. Diabetes, Lakshmi, as we all know, India की सबसे बड़ी बीमारी हो गई है. And it is so prominent and it affects each and every body part.
Absolutely.
So it is one disease I have seen that even if it is controlled, it can silently go on. You know,
Cause something or the other.
yeah.
Yeah.
सुब्रमण्यम जी, आप बिल्कुल ठीक कह रहे हैं. डायबिटीज हमारी जिंजाइवल हेल्थ के लिए एक बहुत बड़ा प्रॉब्लम है. Now I'll tell you a very interesting incident. You will may not believe, but dentists are often the first people who detect diabetes in a patient. Now, this may sound strange to you. How can this be possible? But it is so common in our dental operatories, and most of the dentists do it, that the moment we start checking the patient and we look at the gums, we ask, are you a diabetic? Are you suffering from diabetes? Because it is a diagnostic picture we see in uncontrolled diabetes, where the gums become inflamed, enlarged, bleed on probing, on touching. Uh, the picture is so diagnostic that we often get blood tests done for diabetes. Diabetes is a debilitating disorder, more so for the gums because of the combined effect that it brings about. My pain stimulus, my bleeding status is higher, pain stimulus is lower, my hygiene measures start exaggerating the problem, and the body becomes so prone to infection that the mouth being the first zone which comes in contact with external stimuli. When I say external stimuli, it means food. It means, you can take care of other body organs in diabetes because they're not coming in contact with the external stimuli, but not the mouth. So, any infection, slight infection, also exaggerates in diabetes. We all know that. So, diabetes doesn't cause bleeding directly, but diabetes, due to the immunocompromised state of the body, starts giving more chance for the infection to thrive in the body. And when this infection is also added by a foreign element, every time you are eating, we are not cleaning, we are giving rise to a bacterial colony in the mouth, there it burst. So in diabetes, we have seen gingival health regress more rapidly than any other disease.
Right. So, you need to check your diabetes, control it. Uncontrolled diabetes is a Pandora's box. I think you should be keeping it under control. And Apollo 24/7 is always there, be it lab tests or any medication that you require. Make sure. And if you have one more question in continuation with diabetes, if somebody has healthy gums and healthy dental issues, अभी कुछ नहीं है, but they are diabetic, how often do they have to come and visit a dentist? Is a prophylactic treatment available for them? What are the red flags that need to be checked in a diabetic person?
That's a very important question. According to the World Health Organization, prophylaxis is recommended. I'll use the word recommended twice a year. Okay.
Acha.
However, this recommendation is not followed in our country as a regime. Uh, More so because there are a lot of issues that go into dental treatment. But I would recommend that if not twice a year, but a yearly visit to your dentist for cleaning should be mandatory, even if you have no systemic disorder, even if you have no gingival bleeding, even if you have no impending health problems. Please visit your dentist. Get your profile. The word prophylaxis means a step before. Okay, so you should go to your dentist and once every year. This is what I would recommend. If not twice, go once.
Right. I know it's not connected to the topic that we are talking here today, but somewhere or the attention, I wanted to bring it to the attention and also take your opinion on it. Last time on this platform, while we were talking about dentistry and other issues, we had our expert was also mentioning that there is a connection between heart attack, stroke, cholesterol levels, and other serious problems. Your oral hygiene or your dental health can be a gateway to all of these. Would you want to establish a connection and give your opinion on it?
I would first like to tell you, Lakshmi, you conduct such beautiful sessions. Do thank the doctor who made you all aware about that from my behalf.
Yes, yes.
Because
Thank you.
why I say that, because we often ignore our dental oral health and take care of other serious health issues without knowing that the origin was somewhere else. Now, I'm not saying that the origin is in the oral mouth, but the oral region is a contributory factor in a lot of diseases. So, when we were talking about, the doctor must have talked about cardiac issues. Um, our body is designed in a way that all our blood capillaries, lymph, everything, is interconnected. Any infection in the gums, they tend to drain into the same blood vessels that supply to the heart. Are you
Yes,
understanding? I'm going to be talking in a very common language so that our viewers can
it's important.
understand.
Very
Yes.
important.
So I'm going to be talking जैसे हम ये सोच सकते हैं that there is multiple tubes are connected, but the same fluid is being drained into from one tube to the other, from second to the third. So what are we doing? We are basically carrying that bacterial colony from one place to the other, depositing it in a certain body part, and then moving ahead. So, this carriage
Yes.
of infections occurs most commonly from the oral region. Why was I talking about in diabetes? Ki exaggeration hota hai because this is a zone which comes in external contact. So,
Ah,
if we do not take care of the gums and their cleaning, the bacterial colony that arose as an incipient, as a simple lesion, now multiplies into a bigger problem. It travels by the blood circulation into the more important organs of your body. So, where do you
right.
nip it in the bud? Nip it in the bud. Go for that annual appointment and get yourself rid of the infection that can cause problems in your body which do not exist now. So please
Yes.
understand. The second part, if I
Okay.
can take Lakshmi, if I can take your minute, lot of medications that we have if we are suffering with certain systemic disorders. Now, this is a second aspect. Now, you are diseased with certain systemic disorders and you take certain medications. Those medications have adverse effect on your gums and causes gingival bleeding, gingival infections, gingival enlargements. Then what are you going to do? So you have to be very aware. Patients who are suffering with hypertension, patients who are suffering with some convulsions or seizures, certain medications of seizures are associated with depression, certain medications like immunosuppressants when patients are having higher grade problems of cancer or any malignant disorders. All these medicines have adverse effect on your gums and can cause gingival bleeding, which we may not know.
Right.
So
Right.
it's very important to be alert.
Alert and aware, and keep a check on your health, and for any kind of physician prescribed test that you want to run to keep your vitals in check, Apollo 24/7 is always there, and you can order medicines or book a lab test. There'll be links in the chat box as well. Well, ma'am, while you were talking, I was looking at who gave me this advice that one needs to. It's Dr. Radosh Lal, in fact. So so thank him, and who's from Indraprastha Apollo Hospitals. He's a dental surgeon there.
Yes.
So that's interesting. Next question that I would want to ask is somebody who wants to ask a lot of them. In fact, uh, Mr. Manish, Priya, and a lot of them are asking, how do the oral rinses like Listerine help? Do they help to counter bad breath? A lot of them have asked this question.
This is another question that I try to escape. I will not be
Escape.
using the name of any. I don't want to use the name of any brands or any companies as per se. But I'm just trying to say mouth rinses. Again, the thing goes back to the toothpaste. Okay.
Okay.
Mouth rinses are for your own liking. If you like the flavor,
Okay.
if you feel fresh with it, use it. But please ensure that it is not alcohol based. Now, why
Right.
I'm going to say a lot of mouth rinses have alcohol as a main ingredient or a base ingredient. Now that starts giving, we get used to that particular brand or whatever, and we feel that I'm not feeling fresh without doing it. Are you understanding what I'm trying to say? That should
You're
that
conditioned
should
and
happen.
you're
Yes. Don't get addicted to the idea that if you've not rinsed, you're not feeling fresh. Are you understanding? So you have to understand that use natural based or non-alcoholic based mouth rinses. And if you ask me about a good mouth rinse, then I will advertise one mouth rinse, which is lukewarm water with a pinch of salt. Do it
Ah, thank you.
morning, do it in the night, and I don't think you are going to be in any problem.
Super.
Please, blood pressure patients
Heron.
can avoid it.
Oh, yes, I know. It's just warm water with a pinch of salt.
Yeah.
There's no problem with advertising this. Please go ahead and make sure that you're rinsing correctly. All right. So, what are the other factors? Here's a registered user's question. What are the other factors apart from bad dental health or dental routine that we've been discussing? Are there any other factors that can lead to gum bleeding, and how can we head towards a cure? This is a registered user's question.
Another common reason for gum bleeding is crooked teeth. When I say the word crooked, I mean malaligned teeth. What
Malaligned,
does a
आगे
mal या आगे पीछे तो इन दोज पीपल जब हमारे दांत प्रॉपरली अलाइंड नहीं है, इफ दे आर नॉट सेट इन अ precision way that they are supposed to be, they make small niches, overlapping areas, certain crevices which are inaccessible for cleaning by anyone. So please do not blame that patient, and that patient should not blame him or herself also, because your access to that area is not sound. So those areas in those patients, now what happens? They are overzealous cleaners, but they can't reach that area. So they have localized bleeding spots. Uh, it's not the generalized bleeding from your gums, it's a localized bleeding spot, which the areas which harbor infection, they are the ones which start bleeding. So, crooked teeth should be set right at a young age only to have sound dental health at old age, because that is a time when actually problems start manifesting themselves in a larger picture.
correct,
So I
correct.
always say all the children, 13, 14-year-olds, 15-year-olds who come to us with crooked teeth, I am not bothered about looks. We all look. आजकल सारे बच्चे good looking हैं, all handsome, smart kids. Their teeth should be aligned in a proper manner to prevent gingival bleeding and poor gingival health in the later part of life.
Right,
So gingival
right.
bleeding can happen due to crooked teeth. It can also happen to certain people who wear certain dental prostheses. Wires can injure, dentures can injure, and it can also occur, like I just said, in patients who have some systemic disorders, like
Correct, correct.
systemic disorders, which can, of course, be leukemias, which, of course, is a bigger topic to talk about. Most commonly, it occurs in pregnant females also.
Oh, yes. I was actually expecting a few of those questions, but I didn't see them here in the chat box today.
Pregnancy gingival bleeding is a common thing to happen, and should not be ignored, because it progresses very rapidly in those 9 months to a pregnancy epulis or a pregnancy granuloma or pregnancy swellings. Now, why it occurs? Because due to certain hormonal changes during pregnancy, the body's inflammatory response becomes extremely acute,
Huh.
and
Huh.
presence of a slight plaque also is built in a very aggressive manner, leading to exaggerated response of the body. Bleeding ho rahi hai, there will be a small growths in the gingiva of the patient, and most of the patients are apprehensive to come to a dentist because they are pregnant. And the mindset is that pregnancy में dentist के पास, one should not go to the dentist when you're pregnant. So it again adds on to the problem. So it's very important to visit your dentist before you conceive.
Oh. See, pre-pregnancy जो हमारे इतने counselings आजकल popular हो रहे हैं, I
Yes.
think dentistry,
Yes.
dental visit भी एक pre-pregnancy
It's
होना
a
चाहिए
must
हमारा.
visit. It's a must visit. Before you conceive, you should. What will happen if you go to a dentist before conceiving? all your tooth checks, whether you're landing up in a root canal in next 2 months, whatever, that can be screened. Your gingival health will be screened. But if you do have pregnancy epulis during pregnancy, the doctor already knows your history, and you have to understand that during these pregnancy gingival bleeding can be treated. It is safe to be treated. Do not have any myths or things in your mind that it is not safe to go to a dentist. But even then, if you have any apprehensions, please do visit your dentist before pregnancy so that you are well informed.
Yeah, yeah, right. So here's a question from Mr. Kuldeep Singh. Are there any medications by which we can make our gums healthy? I think he's
Could,
talking about supplements, not just medications. I think he's pointing towards supplements.
Kuldeep ji, this question has how to make my body healthy. Then it's a very generalized forte that we look at. Our gingival health or the oral health predominantly depends upon a lot of multivitamins present in the body, antioxidants, as I call, there's a bank of multivitamins and antioxidants in the body. Any depletion of these multivitamins and antioxidants reflect in our gingival and the gum health and the oral health. So, if you are having an adequate supply of the multivitamins and antioxidants, your gums will remain healthy. Predominantly, the zinc, the vitamin C, vitamin B, vitamin A, all of them. There's a proportion that that whose adequate presence. I'm using the word adequate because you just can't start popping in. Adequate presence uh, will ensure that your gums are healthy.
Right. So next question is somewhere related. Supplements लेना है, खाने के बारे में है. This is a registered users question. I don't have name, gender, and age here. What are the foods that can prevent bleeding gums? In fact, I would want to add what are the foods that can cause bleeding gums as well.
See, any food that can prevent bleeding gums. See, if there is a diseased state, nothing can prevent.
Nothing can prevent.
You have to,
Yes.
you have to get treated. You have to get treated. Foods that cause bleeding. If you have diseased gums, I would advise you not to have harsh, hard, crisp food items that cause trauma to the gums. If you are in any state of gingival disease, I always advise to avoid hard, crisp food materials to avoid injury to my already diseased gums. As per se, food, if you have good healthy diet which has good vitamin supplements, fruits, I don't think you will land up in a problem. You just have to be vigilant that the gums are healthy and not diseased. If they're already diseased, food items really can't help you at that stage. It can help you
Right.
before that.
So one quick question: the acidic, the citric, the pH values keep varying in foods, and sweet, excessive sweet, colas, carbonated drinks. Do they also have some kind of effect? One quick roundup there.
Yes, absolutely. See, when we are talking about fruits and citric acid, to be precise, why I did not talk about it, because citric acid based foods, that is, we are talking about the orange family, the orange and the mosami, or what we call in northern part of the country. I don't know how the different names that we
Almost the same,
use
I
in
guess.
different parts of the country. The citric family has deleterious effect on the heart tissue, on the tooth surfaces. They cause attrition, abrasions on the tooth surfaces. On the gingival health, they do not cause any direct effect. So we cannot blame the gingival health and the citric family thing. Citric family and even acidosis in the human body, gastritis, affect more of the heart tissue or the tooth surfaces of the body.
Alright. So, ma'am, one quick, I need to sum up, and towards the end of the show, I want you to give top tips. But for now, two quick last questions. Quickly answer, please. Mahendra Rath ka question hai. I feel that gums and skin within my mouth have weakened earlier. Now the gums are bleeding. One question, राउत जी, आप आपके डेंटिस्ट के पास विजिट कर चुके हो या नहीं? So, what's the help that we can offer him right now?
अगर आपको खुद ही रियलाइज हो गया रावत जी कि आपके टिश्यूज और स्किन वीक हो गया है और अब जिंजावा में से ब्लीड भी हो रहा है, देन आई थिंक यू रश टू अ डेंटिस्ट, because nobody can really talk about it and help you out. आपको ट्रीटमेंट की ज़रूरत है, और जितनी जल्दी हो सके ये ट्रीटमेंट शुरू करवाएं। सबसे पहले तो क्लीनिंग ही करवाएं एंड देखिए आपके टिश्यूज का क्या रिस्पॉन्स रहता है, एंड देन प्रोसीड फर्दर।
Wonderful. So you have been right from the beginning of the show. You've been advising some tips to take care of your oral hygiene so that your gums and dental health is in good shape. So can you please give us top tips to take care of our gums?
Top tips. Okay, now everybody, please listen to this very carefully. I know since our childhood we have been advised to brush our teeth first thing in the morning. Please don't do that. Now, I know I'm going to sound very strange. Brush your teeth after breakfast. Remember, brushing is like cleaning or mopping your house. Whenever you throw something on the floor, you don't let it be and say that I'm going to now mop my floor at 8 o'clock tomorrow morning. You don't do that. You clean it right at that time. So, in the same manner, brush your teeth after breakfast, rinse after lunch if you are in office or in school, and brush right after dinner. Do not wait that you will brush your teeth before going to bed, because that time the damage is already done. The first thing in the morning when you get up, rinse your mouth, but brush after breakfast. Because if you do not do so, the food in your mouth that remains the entire day after you move out, after consuming your breakfast, spoils your gingival health to the extreme. This gingival health is very important to maintain because it is the supporting tissue of your teeth. If you do not take care of the supporting tissue, there will be no use taking care of the decays or dental caries, which we are more worried about, because your tooth will slacken, loosen, and fall out. So, gingival health is the most important uh, thing to be taken care of. Remember, mouth is your gateway to your personality, to your persona, to your smile, and to your introduction to the society. So please take care of it in an honest manner. Thank you.
Thank you so much, and you have brightened up our, with so much of information. You brightened up my smile. I take back the wonderful tips that you have shared, and I will start to incorporate them after breakfast. Brush her. You just have to culturally set that pattern in your head.
Yes,
It
yes,
takes some
yes.
time, but wonderful, Dr. Shweta. Great meeting you here on this platform.
Thank you so much, Lakshmi. It was great having you to talk to you, to a beautiful lady, has a beautiful smile herself, and to all your viewers for asking us such wonderful questions, which enabled other people too. Thank you so much.
Thank you so much once again, Namaskar. And I'm heading towards health quiz. Health quiz के rules ये है कि you have to answer on the YouTube chat only. You must be watching this on Instagram, Facebook, or any other social platforms. But if you want to participate, please come on to YouTube chat and type your answers there. Winners' names will be announced towards the end of the show, and winners will be selected at the sole discretion of Apollo 24/7 team. And winners to be you have to mail your details, all your contact details at marketing at apollo247.com. Gift vouchers will be shared with you. A word, we are not against you guys participating regularly. We appreciate that you participate and we want you to win. But to actually credit the gifts and the gift vouchers, you need to have Apollo 24/7 from a different number, not just an email ID, from a different phone number. Please go ahead, download Apollo 24/7 on your phones and do participate in the quiz. तो चलिए आज के क्वेश्चंस देख लेते हैं. Question number 1, fill in the blanks. Bleeding gums may be a sign of poor dental. Last word में blank से देखिए, H से शुरू होता है, H space GI space NE. So what's that word? Poor dental, and fill in the blank there. Question number 2, true or false में answer दीजिए. Gum bleeding while brushing is normal. Is that true or false? Question number 3, yes or no में answer दीजिए. Gum disease can still occur if you have no cavities. So these are the 3 questions for today. And while you all are answering, I can see Kanupriya, Harminder, Manish Sharma, Naveen, Pradyuman, all of you are answering. While you are answering, let me give you gift vouchers that can be used on Apollo 24/7. The first one that we give away is Ask DOC 150, ASK DOC 150. Use this code to get 150 rupees cash back on online doctor consultation, and you can consult top doctors direct from Apollo on Apollo 24/7 app. And the next one that we give away is Apollo 24/7's, you can order medicines and get up to 2-hour delivery as well. Here's the coupon, first 3 FIRST3. Use this to get 25% off on online medicine orders. First 3 orders which are above 1,000 rupees of worth, you can order and get 25% off as well. So the next one is HH247. This is an exclusive code that we give away for our Health Hub viewers. If you are new and if you are watching this show, go ahead, make note of this code HH247 and apply this on Apollo 24/7 when you consult. You get 199 off on online consultations with Apollo doctors. And if you're buying medicines, then you get 20% off on medicine orders. This is in addition to the other coupons that we have given. So go ahead and use these. Well, Apollo 24/7 is just a call away. You can call, text or WhatsApp on 9355247247 to avail healthcare services. Download Apollo 24/7 now. And by the way, next week we are talking about how to prevent diabetes. हमने diabetes management के बारे में बात किया है. And now how to prevent diabetes, which is a large subject. We shall see you on 3rd September 11 a.m. with a wonderful topic. This week's winners, I'm going to announce your names: Manish Sharma, Kanupriya and Pradyumna. You are the winners for this week. Please go ahead, write to us at marketing@apollo247.com to claim your prizes. Thank you all. Thank you for asking your questions. Next week milte hain. Namaskar.